Well, good morning, and thank you for the lovely introduction, Helena. It is so exciting to be here to showcase sort of the end, almost, not quite, we've got one more month, the end of our journey, but we hope the beginning of some new journeys that we'll tell you about later. I'd like to thank Mark Buttigieg for coming today. It's a busy time and we appreciate your time. And also Tony Wesleyan, thank you so much for your support today and beyond today, and I acknowledge the Durug people. Right, we have been on a long journey. These are some of the outputs that we've produced, and I won't talk you through all of them, but you can see we've surveyed people, we've written reports, we've carried out workshops, we've had community practice meetings, we've presented, we've done a lot of things. But what I want to do today is share with you just a tiny slice of some of the findings and encourage you, I guess, set the foundation for the rest of today, where you'll get the opportunity to find out more about what we've been doing. So what is this project all about? As has been mentioned, it's focused on this very important sector, the healthcare and social assistance sector. Of course, delivering critical work for our society. I don't think that's in dispute at all. But it's a sector that is challenged, and we'll talk a little bit more about that shortly. But our focus is on work design. So we are wanting to move towards more prevention of harm. What the hell does that mean? Very simply, it means let's create good, healthy work where people go to work and are engaged and not stressed. So that's simply what we're trying to do here. And so we use the smart work design model, but we also adopt a particular approach, which I will tell you about in just a moment. We're not trying to, at this point in time, in the last 4 years, we've not been trying to transform the whole sector, but more to do a sort of proof of concept. If we invest in this, can we get some evidence that it might work? So that's what we've been trying to do. So the model, I think if I tested you, we'd pretty much find most people know what this model is very quickly. This model captures sort of 100 years of research on this topic of work design around what are the sort of core ingredients, we can think of it like that make for healthy work. So having stimulating work where you're interested and engaged. Mastery is all about having clarity, knowing what it is you're actually meant to be doing when you're at work, having agency or autonomy. Relational component of work, we're social creatures, so work, it's important that we support each other at work and have connection. And then T is all about making sure that those emotional demands, time demands, cognitive demands that people have in work are manageable, and we call that tolerable demands. There will be a workshop which goes deeper into this model a little bit later. If you're not familiar with it, you'll get lots of opportunity. Now, if we want to create smart work in the workplace, there are many different things that we could do. If we had the power, we might change funding models, for example. We could change at the very top of the level of the organisation. But what we're doing here is really focusing much more on a co-design model. So involving the people who actually do the work in reshaping that work. So we use this model that we call PARRTH, the PARRTH to work design. And it's very simply a sort of a process for involving people who do the work in the redesign. So preparing, laying the foundation, assess, because we shouldn't solve problems unless we fully understand what they are, reflect, make a little bit of sense of those problems, feedback to people, then redesign. So can we do it differently? And this is where we involve people in that process of redesign. Track, has there been any impact? And then habituate is all about, okay, well, things seem to be working. How can we now embed this into everyday practice, make sure it doesn't disappear, so sustain it, and perhaps scale more broadly across the organisation? We've had the benefit of fabulous partnerships and you will see that we profile 7 partners today, and you'll get the opportunity to find out more about their work shortly. Before I share a couple of our findings, I do want to acknowledge that this is a sector under pressure, and as has already been mentioned by Tony, the level of psychological injury claims is much higher in this sector. This is an analysis that Professor Alex Colley did as part of this project of psychological injury claims, and that top line is the healthcare and social assistance sector, and you can see it's way higher than other sectors, but you can also see that there's a very steep incline and growth in the number of those psychological injury claims. So that's why we're focusing on this sector. And when we analyse what sort of things are going wrong to cause those claims, 2 things in particular of the SMART model come out. One is the relational component, so harassment, bullying, conflict sorts of things. And the other is that tolerable demands, so people reporting a lot of pressure in these contexts. Another project that we've been looking at is not just analysing the objective data, but looking at the experiences of people in the sector, and we get the same story. So we surveyed several thousand carers in New South Wales. 1 in 5 are reporting high levels of burnout, 1 in 6 are disengaged, and 1 in 12 are considering leaving. So those experiences sort of dovetail with that story of psychological claims increasing. We sort of see this, though, as a bit of an iceberg metaphor, because that's what we're seeing. We're seeing the burnout and the stress, but what's underneath that? What's causing that? And our data suggests that it's very often about poor work design. So, for example, if you take the people with the worst work design in this sector, the bottom 15%, 1 in 2 of those individuals is burnt out, half. So you see there's this very strong connection between people's work design and their mental health and well-being in the workplace. So you can imagine in this context, trying to have a project about change is challenging. And we faced that we originally had 8 organisations, lots of mergers, takeovers, CEOs leaving, staff leaving, constrained resources, people who are overloaded, and then we're asking them to get involved in change. So this is a challenging context. But nevertheless, I think we've made some inroads. And what I want to share with you are just 2 examples. We don't have time for more. And then encourage you to look at the bigger picture as well. So let's turn first of all to one of our residential aged care organisations. So when we do that sort of assess phase in the PARRTH process, what we discovered in this case was that communication and handovers were a real issue. So poor communication, poor handover, mean you don't know what's happening with patients, with clients. That can result in conflict and confusion. And so this was really affecting the mastery and the relational aspects of work. So through the PARRTH process, the team came up with some very simple ideas for redesigning the work, such as something as simple as having a whiteboard where instead of having to rely on the nurse sharing all the information about the handover, and often the nurse was busy doing other things and then people didn't know what they were doing and so on, have a whiteboard and put the information on. It's so simple. But as you will see, these sorts of things make a difference to people's working lives. And changing checklists and these sorts of things. So what did we see? And these are all measured effects, comparing the situation before and after. We see a significant increase in knowledge sharing. So people are sharing more knowledge now as a result of these simple changes, and more support. So taking away some of that conflict that we previously observed. So you can see this is just one result for co-worker support. So what you can see there is the change group, the group that we were working with, is that dark blue line. You can see that the support increases. It's sort of interesting to note that the business as usual group, things are getting worse. That was a pretty common finding in quite a few of our analyses, that it's not just, this intervention is not just about making things better, it's about stopping things from getting worse. So we saw that in quite a few of the findings. But let's hear from one of the people involved. Now there is very clear insight of what I should be doing, who my partner is, how I should be working in the team. So the teamwork has become very flexible, and because of the proper communication, the work becomes more smooth. Let's have a look at a different example, this time in a disability care organisation. In this particular organisation, demands were a real issue, emotional demands, workload demands. But what we know from research is that demands are made worse if you have a lack of clarity, so you're not sure what you're doing, and you don't have autonomy and agency to deal with your demands, and you don't get the support. So in this case, there were 3 sites in this organisation who did different things, and I won't go through the details there, but you can see they co-designed these solutions. So these were the things that the people doing the work thought were really important things to do that would make a difference to their demands and their experiences at work. So, for example, creating a stronger sense of teamwork and relational work through this, there's no I in team, and all of these initiatives had things behind them. What happened? So again, with our pre-post measures, we saw a reduction in time pressure, a reduction in role conflict, and that's this sense of being pulled in different directions, and a reduction in work-family conflict. So more tolerable demands. We saw more feedback, so more mastery, so people know how they're doing better. And we saw more support, and we saw more psychological safety. So that's that feeling that you can be open and be yourself at work. We also saw all of this leading to a reduction in burnout. So just to show the burnout findings, what you can see here is the change group is the dark blue again. Reduction, significant, this is a statistically significant reduction in burnout, but the business as usual group who didn't have this intervention, again, you see it getting worse, actually. So a nice evidence that this work redesign process can really make a difference to the mental health and well-being of the workforce. That's just 2, don't have time to share more, but we have similar examples from all of our participating organisations, and we actually haven't quite finished yet too, because we've got some more data still coming in, so we'll have some more examples. So at morning tea, you will be able to go and talk to the people and find out about some of the other changes and initiatives that have been happening. I just want to address some questions that you might have at this point, because I think that there's a danger you're going to go away and people say, what was this about? And it's like, oh, well, yeah, they had whiteboard intervention. And, like all these multiple thousands of dollars, and they had a whiteboard intervention. What is this intervention that we are doing here? Is it handovers or is it whiteboards? What is it? What the intervention is here, and this is really important, the intervention is the participatory change process by which trained and supported staff co-design and implement work redesign. That's the intervention, giving the workers the opportunity to redesign the work and the time and the skills to redesign the work themselves. That's the intervention here. Actually, it's really an intervention to increase agency, to increase autonomy and voice of the workers. That's really what this intervention is all about. And I just want to share the words of one of the nurses, which really speaks to this point. We feel much safer and more comfortable saying our issues to leaders and knowing if you tell them something, they will listen to you. Things are going in a positive way. We're very happy about that. So this sense of voice and agency, and that's super, super important psychologically. So that's what this intervention is about. Can we be confident in these findings? Yes, we can. We have used very rigorous, in fact, we've sort of created a rod for our own back in some senses, because we will only call this change when we show a difference in pre-post, over time, a statistically significant difference, etc. These are very rigorous findings. You'll find a lot of people talking about evidence in this, but have a little dig beneath the surface, and sometimes it's quite anecdotal. This is rigorous evidence here. And we believe, and we're seeing it with some of our Time 3 organisations, that we'll get more and stronger effects if we allow more time to pass and more people to get involved. So why does this focus on work design matter? There's 3 sort of reasons. One is very simple compliance. You all know psychosocial hazards, big deal, got to deal with them. And there's this focus on hierarchy of control, which is all about don't just do the Band-Aid thing, but prevent harm. Work design is about creating better work to prevent harm. But it's not just that. Actually, and you can see it from our findings, good work design helps to engage, motivate staff and retain them. And almost certainly means better care of people. I think the most important thing is that it shows that positive change in this sector is possible if you've got the commitment and skills of the people involved. I won't go into detail. We've learnt a lot about, if you want to ask, what is it that helps and hinders? Workshop 2 will be all about change, and we'll cover some of these enablers and barriers. We also have a beautiful report that we're happy to share with you on this topic. We have loads of resources, and I believe if you scan that thing on the table, you can access some of them. So we've got tip sheets and so on. So lots of resources that people in the sector can access. The third workshop, we've talked about 2 workshops. The third workshop will be about the platform that we've developed as part of the project, and that's sort of the measurement tool that helps with the assess and the track part of the PARRTH model. Typically the approach at the moment is we rely on things like lots of people are leaving or absent or putting in claims, but we're not really getting to that sort of cause. And so our platform is really all about saying, well, what are the work issues in this context? It's designed for this sector. It has health care and social assistance benchmarks. It's evidence-based. And it's designed for action because all of those resources that I mentioned are embedded into that platform. So that will be available, and there is a workshop on this. So I will end there. I have 1 minute apparently. But look, can I just take that 1 minute to say thank you so much for coming. We know that everyone is overloaded and busy, and really appreciate that you've taken the time out of your busy schedules to come and learn and find out about some really super exciting things that have been happening in this sector. So thank you. I'll be back a little bit later to say a few more words, but I hope that little taster of what we've been doing inspires you to have some great conversations at morning tea. So thank you all so much.